Welcome to the deep dive. Today we're really getting into the weeds on the U.S. response to COVID-19.
Yeah, we've got this, in this final report, it's packed. Analysis, findings, interviews, the whole lot.
And our mission really is to cut through all that information and pull out the key stuff, the surprising links, the big takeaways.
Exactly. We want to give everyone a clear picture, origins, economic hits, public health debates, vaccines, without getting lost in the sheer volume of it all. Make it understandable.
Okay, let's start right at the beginning then. The origins, the initial reactions. The report mentions these U.S. government assessments.
Right, from early 2021 and then backed up by an ODNI report in June 23.
Suggesting researchers at the Wuhan Institute of Virology, the WIV, might have been sick back in autumn 2019.
Before the official outbreak timeline, yeah. And the symptoms were, well, consistent with COVID, but also other seasonal stuff, so it's complex.
But what does that timeline imply, especially when you connect it to other things?
Well, it's interesting when you look at the Proximal Origin paper discussion. The report details these calls.
Yeah.
January 31st, February 1st, 2020.
Involving people like Dr. Fauci, Dr. Collins, Jeremy Farrar.
And apparently a key goal stated by Dr. Christian Andersen was to, quote, disprove the lab leak theory.
Which does make you pause, doesn't it? Why focus so early on disproving one specific theory?
It's a fair question. And then there's the detail about who wasn't involved or involved late.
Like Dr. Redfield, the CDC director then. He wasn't on that February 1st call.
And Dr. Ian Lipkin, another author on Proximal Origin. He wasn't invited to the call and apparently saw a draft pretty late in the game.
Almost 2 weeks after the first version. What does that suggest about how that paper came together? Kind of managed, maybe.
It certainly raises questions about the process, and then you layer on the Defense Intelligence Agency's working paper from May 2020.
The one criticizing Proximal Origin.
Exactly. They argued it didn't actually rule out a lab origin, especially considering the furin cleavage site.
The furin cleavage site. That keeps coming up. Why is that specific part of the virus so significant here?
Because it helps the virus enter human cells more easily, and the debate is whether it could realistically appear naturally or if it points towards, manipulation.
And even Dr. Anderson acknowledged, didn't he, that a site like that could potentially be made in a lab.
He did, which makes the strong push to disprove the lab theory even more, well, noteworthy.
And there's more intrigue. The report mentions this anonymous whistleblower.
Right, contacting a reporter, claiming plagiarism in Proximal Origin, suggesting that's why Nature initially rejected it.
Which led to this flurry of emails, right, between the authors, Fauci, Farrar.
Yeah, Dr. Anderson seemed worried about even confirming the February 1st call happened, and Farrar's response was basically, let's get our story straight first.
Wow, that paints a picture of some very careful message control around the early narrative, doesn't it?
It definitely suggests a high degree of sensitivity, maybe a lack of full transparency in those early days.
And this ties into other concerns, too, like DARPA turning down funding for that EcoHealth Diffuse proposal.
Yeah, citing biosecurity concerns. So even before the pandemic hit, there were red flags being raised internally about the type of research being proposed.
Okay, let's pivot to that research itself. Gain-of-function and EcoHealth Alliance. It gets complicated fast.
It does. First, you need to understand the NIH definition. Gain-of-function just means research giving a biological agent a new ability.
But there's a specific subset they're really concerned about, right?
Exactly. Enhanced potential pandemic pathogen research, or enhanced PPP. That's the stuff under the P3CO framework research, specifically making a pathogen potentially more dangerous to humans.
Why is that distinction so critical?
Because a lot of the controversy revolves around whether the Research EcoHealth was funding at WIV crossed that line into enhanced PPP territory, and whether it was properly flagged and reviewed.
And the report digs into the NIH grant to EcoHealth, the delayed Year 5 report.
And Dr. Daszak's statements about being locked out of the reporting system. The report suggests emails show he knew the delay was for other reasons, like a misunderstanding about the grant being refunded.
So, conflicting stories there. What does that tell us about the oversight? Seems messy.
It suggests communication breakdowns, at the very least. And then you have the grant suspension and reinstatement saga.
Where the big fight was over who actually had the virus samples and sequences. EcoHealth said WIV.
Right. And Dr. Erbelding from NIH testified they thought EcoHealth could get those samples when they reinstated the grant.
But it's a huge question mark whether NIH would have done that if they knew the WIV, which is now debarred, had sole control, right?
Exactly. It raises serious questions about the due diligence involved, given the circumstances.
And the report also notes the Trump administration stepped in to terminate that grant initially.
Citing concerns about WIV and compliance issues, the report implies that without that intervention, the funding might have just continued despite the growing concerns.
It makes you think about how politics and science funding can get tangled up.
Definitely.
Okay, shifting gears completely now, but equally concerning the fraud. The sheer amount of taxpayer money lost from pandemic relief funds.
It's staggering. The report points to transnational crime groups, domestic fraudsters, basically exploiting weak oversight.
And these weren't just random actors. Many were involved in other organized crime. How did the oversight fail so badly?
A big factor the report highlights is how siloed off the federal agencies were. They weren't coordinating effectively.
So no one had the full picture.
Pretty much. And they failed to properly validate applicant information. That led to massive fraud in programs like emergency rental assistance, PPP, EIDL.
The Paycheck Protection Program and the Economic Injury Disaster Loans. What kind of numbers are we talking about?
Just for PPP and EIDL, the estimate is around $200 billion in potentially fraudulent funds.
$200 billion. That's incredible. It highlights the absolute need for strong checks, especially when money needs to go out fast.
You'd think so. But the report says the Small Business Administration, the SBA, didn't even use basic prepayment controls consistently.
Like the Treasury's do not pay list.
Yeah, or checking against databases that flag people owing child support or other government debts. They found over $120 million in loans and $24 million in grants went to people on the do not pay list.
How does that even happen? Were they just overwhelmed, or?
Probably a mix of things. The pressure to distribute funds quickly, maybe not enough resources for proper checks. And recovering the money is hard, too.
Why is that?
Well, for instance, the Social Security Administration could only share its full death data with the Do Not Pay system for 3 years. That time limit really hampers efforts to claw back funds paid out improperly after someone died.
So the lack of good controls up front has these long-lasting consequences.
Absolutely.
Okay, let's look internationally. The World Health Organization, the WHO. The report brings up their early assessment in January 2020.
Right, initially saying no clear evidence of human-to-human transmission.
Which contrasts sharply with what U.S. intelligence later found about a CCP cover-up and deliberate misinformation.
And it took the WHO a whole month after the first real warnings to actually acknowledge human-to-human spread was happening.
What does that delay suggest? Was it just the fog of war or something else?
The report points to documented pressure from the Chinese Communist Party, the CCP, on the WHO. It suggests this pressure might have influenced the timing of key declarations, like the Public Health Emergency of International Concern, the PHEIC, and calling it a pandemic.
So, geopolitics potentially interfering with public health timelines.
It seems that way. Plus, the report mentions the CCP's cyber spying, actively targeting U.S. research on vaccines and treatments. That's a major threat.
Definitely something to watch.
Yeah.
And the report briefly notes there are ongoing negotiations now for a new WHO pandemic agreement and IHR revisions.
Yeah, trying to learn lessons and reform the system. We'll see how that plays out.
Okay, back domestically. Public health measures. The report flags that initial over-reliance on WHO guidance.
And problems with the Strategic National Stockpile, the SNS. Apparently, PPE was depleted during H1N1.
And never properly restocked for a respiratory pandemic, even though everyone knew PPE would be crucial.
Right. It points to gaps in preparedness, maybe wishful thinking.
Another huge vulnerability mentioned is the pharmaceutical supply chain, our reliance on China for active ingredients.
The report uses strong language giving China a global chokehold. It's a serious national security risk, isn't it? If they could just turn off the tap for essential medicines.
It really is. Now, what about masks? That was such a contentious issue.
Hugely. The report analyzes the shifting guidance from the Biden administration, the CDC, Dr. Fauci's statements, and points out it often seemed inconsistent or not fully supported by clear science at the time.
It mentions peer-reviewed studies questioning how effective broad mask mandates really were, especially for things like flu or even in schools.
Yeah, including studies that were used to support school masking, which, according to the report, lacked a proper comparison group like an unmasked control group.
Which definitely raises questions about the evidence base for some really significant policies.
No doubt.
Beyond masks, the report tackles lockdowns and their consequences.
And they were severe. The report uses CDC data to suggest almost 100,000 excess deaths per year in 2020 and 2021 that weren't directly from COVID.
Wow. What caused those deaths?
It varied by age group: drug overdoses, accidents, heart disease, diabetes. And a big factor was likely the delays in routine medical care, cancer screenings, procedures put off because of lockdowns.
So a massive indirect health toll from the response itself.
That's what the data suggests. The report also touches on vaccine passports, noting the arguments that they felt punitive, discriminatory, and maybe eroded public trust.
Yeah, deepening divides. Now, there's a really specific and troubling section on New York State and nursing homes.
Yes, the March 25th, 2020 directive, it basically forced nursing homes to accept residents potentially positive for COVID and banned testing them beforehand.
Even though Governor Cuomo apparently knew the risks to the elderly.
The report indicates he was aware. And it says the directive came after a request from the Greater New York Hospital Association, presumably to free up hospital beds.
But the human cost in the nursing homes. And the report notes his top aide, Melissa DeRosa, didn't sign off on it.
That's stated. And that the directive was eventually ended because of public outcry, not because the science changed.
Then there's the July 6th report on nursing home deaths. The report alleges significant manipulation there, too.
Yeah, detailing involvement from the governor's executive chamber, including Mr. Rosa again, removing data on deaths that occurred outside the facilities.
Which obviously skewed the numbers lower.
Right. And Mr. Cuomo himself reviewing and editing it to make the findings seem less like the state's policies were directly responsible. Even the peer review process involved external parties connected to the administration.
And they withheld the out-of-facility death data even after admitting it was inaccurate. What was the justification?
They claimed it didn't change the ultimate conclusion, but it clearly changed the perception of the scale of the tragedy. It raises huge transparency flags.
Absolutely. Okay, let's touch on testing and travel restrictions briefly.
Testing had a rough start, definitely. But the report does credit the public-private partnerships, like Operation Warp Speed's diagnostic side, for eventually getting tests widely available and accurate.
And travel restrictions, like the ones on the UK.
Dr. Fauci, according to the report, still maintains they were effective, that they bought valuable time for the U.S. to prepare.
Okay, now vaccines. Operation Warp Speed on the vaccine side is generally seen as a success, right? Getting them developed fast.
Unquestionably, a major achievement in terms of speed. But the report also details concerns within the FDA later on.
Like Drs. Gruber and Krauss, top vaccine officials who resigned.
Exactly. They raised concerns about feeling political pressure from the Biden administration, particularly around booster timelines, feeling they were arbitrary, not purely science-driven.
And CDC Director Walensky overriding the ACIP Advisory Committee's recommendations on boosters.
Yeah, that was unusual and raised eyebrows about political influence over scientific bodies.
The report also gets into the EUA versus BLA distinction for approvals, emergency use authorization versus the full biologics license application.
And the concern that sticking with EUA for longer than maybe necessary might have hurt public confidence in the vaccines. People see emergency and think maybe it's not fully vetted.
Even though the standards were high. And there was internal FDA discussion about pressure to speed up full BLA reviews, potentially to support mandates.
The report suggests those discussions happened. It all feeds into this theme of potential political pressure on regulatory processes.
Another major point the report brings up is natural immunity and infection-acquired immunity.
Right. Citing studies showing it's robust, long-lasting, often comparable to vaccine immunity. It mentions the Great Barrington Declaration, folks.
Who advocated for focused protection rather than broad lockdowns.
And Dr. Collins documented efforts to orchestrate a takedown of that declaration. It raises the question, how should policy have factored in natural immunity? It often felt ignored in mandates.
Speaking of mandates, the report covers the federal ones for employees, military, the OSHA rule for businesses.
Plus all the private company and university mandates, and the consequences: people losing jobs, resigning.
It cites a British medical journal paper arguing these mandatory policies actually damaged public trust, potentially violated rights, and caused social harm.
It's a critical perspective included in the report.
What about vaccine safety, the systems for tracking potential problems?
The report discusses VA-EARS, the Vaccine Adverse Event Reporting System. It acknowledges its limitations. It's a passive system. Underreporting is likely.
And it might miss certain signals, especially complex neurological ones.
Potentially. It mentions a New York Times piece about people who believe they suffered vaccine injuries feeling ignored, and how hard it is to capture things like brain fog in standard medical records.
There was also vSafe, the smartphone-based system. But controversy over accessing that data, too.
Debates about transparency and who got to see the raw data.
And if someone does believe they were injured by a COVID countermeasure, what's the compensation system like?
That's the CICP Countermeasures Injury Compensation Program. The report highlights how limited it is compared to the regular vaccine injury program, VICP. Very high burden of proof, much smaller payouts, if any.
And a huge backlog of claims.
Massive. The concern raised is that without a fair and accessible compensation system, you risk fueling more vaccine hesitancy. People think, if something goes wrong, I'm on my own.
And the report makes a point to distinguish between people worried about potential injuries and the broader anti-vax movement.
Yes, it emphasizes they are not the same group. It even includes a personal anecdote from Chairman Wenstrup questioning a booster based on his own natural immunity test results.
The overall argument being that mandates, in some ways, fractured the doctor-patient relationship, undermining trust.
That's a perspective discussed, yeah. Taking the decision out of the hands of the individual and their doctor.
Okay, let's talk economic impact. The report stresses it wasn't felt evenly.
No. Rural areas, low-income communities, small businesses got hit disproportionately hard. Hundreds of thousands of businesses expected to close permanently.
Supply chain chaos hit small and medium businesses particularly badly, too.
Definitely. The report mentions some relief measures like TFAP for food banks and the EIDL loans we talked about earlier.
But it also criticizes some mitigation measures as arbitrary. Social distancing, for example.
Yeah, particularly the 6-foot rule. The report notes Dr. Collins himself admitted there wasn't strong scientific evidence specifically for 6 feet versus, say, 3 or 10. It just kind of became dogma.
And the pandemic accelerated trends like remote work, e-commerce, automation.
Which had knock-on effects, especially for lower-wage workers whose jobs maybe didn't recover as quickly or changed fundamentally. It also briefly mentions the Fed's monetary policy actions.
What about schools? The impact of closures was huge.
Devastating. The report cites evidence suggesting schools weren't the super spreaders some feared, especially early on, and that some studies used to justify keeping schools closed or imposing strict measures may have exaggerated the data.
And it specifically calls out the American Federation of Teachers, the AFT.
Yes, highlighting their advocacy for what the report calls overly broad or unscientific measures, like specific triggers for closing schools again.
And their influence on the CDC's guidance for reopening. There were emails back and forth.
The report details communications between AFT leaders and White House and CDC officials, suggesting the union had significant input, sometimes leading to stricter guidance than initially proposed by CDC scientists.
And the result? Massive learning loss for students.
Significant academic setbacks across the board, a major consequence.
Finally, the report covers something quite disturbing. Obstruction of the investigation itself.
Yeah, pointing fingers at HHS for slow-walking documents, heavy redactions, sometimes providing less information than what was released through FOIA requests.
And guidance given to Dr. Morens at NIH about what he could and couldn't tell the subcommittee.
Right. It also details obstruction by EcoHealth Alliance, and Dr. Daszak admitting his goal was damage control for EHA, alleged false statements about FBI communications, limiting document searches.
Even Dr. Quaish initially being reluctant to provide documents.
And Dr. Morens, again, using personal email to dodge FOIA, knowing it was against policy, denying he had other accounts.
It suggests a pattern of trying to conceal information. And the Cuomo administration.
Similar story, according to the report, failing to respond adequately to requests, calling the investigation illegitimate, withholding thousands of documents claiming privilege.
Even communications with outside parties regarding that March 25th nursing home directive. Claiming privilege there seems broad.
Very broad. The report argues it hampered their ability to fully understand how those decisions were made.
So, wrapping this all up, it's been a deep dive indeed. We've seen these recurring themes, haven't we?
Definitely. The sheer complexity of the science and the struggles communicating it. Major questions about government oversight, accountability.
The huge economic and social ripple effects of the policies chosen.
And, maybe most importantly, the critical role of transparency and public trust. When that breaks down, everything gets harder.
It really does. So the final thought we want to leave people with, based on everything this report lays out.
Yeah, thinking about all these lessons learned or lessons we should be learning, what are the absolute must-do changes?
For our public health infrastructure, our whole pandemic readiness playbook, how do we build a response next time that's more effective and, crucially, more trustworthy.
It's about finding that balance, isn't it, between keeping people safe, respecting individual liberties, and ensuring scientific integrity leads the way, free from undue influence. Lots to think about.